Hello, everybody. My name is Maggie Fowler. I am the District Licensed Professional Counselor for Cal Allen ISD, and we're doing the Mental Health and Wellness Series for Cal Allen ISD. Today we have Dernie Coley. She is a social worker through TCHAT and UTRGV, and she's going to talk about mental health and hopefully give us some resources at the end. And if not, I will have resources for the Cal Allen and Corpus Christi area for you guys if y'all want. So I'm going to turn it over to her and let her present on this awesome topic.
All right. Well, thank you, Dr. Fowler, and thank you all again for joining me once again this morning for this presentation on Let's Talk About Mental Health. So what I would like to cover or hope to cover during this presentation is just talk a little bit about some facts and myths about mental health, actually get into the meat and bones of what is mental health and what factors impact our overall mental health and well-being, some common mental health problems that we see and that individuals experience, and at the end, some resources as to where can I get help. So I want to start out by going over having like a mental health quiz. So the first question, and you can either type your answers in the chat, or if you just want to speak out, you can unmute yourself and do so. Myth or fact, mental health problems are rare. Well, that is a myth. Mental health problems are not rare. In fact, they are quite common. According to the World Health Organization, WHO, 1 in 4 people worldwide will be affected by a mental or neurological disorder at some point in their lives. This means that mental health issues are widespread and can affect anyone regardless of age, gender, ethnicity, or social economic status. It's important to recognize that mental health problems are just like physical health problems and should be treated with the same level of importance and care. So our next question, people with mental health problems are violent. Myth or fact? Well, that too is a myth. It's a common misconception that people with mental health problems are more prone to violence. However, research suggests that the majority of individuals with mental health conditions are not violent. In fact, they are more likely to be the victims of violence or to harm themselves rather than others. It's critical to understand that mental health conditions vary greatly and individuals experience them differently. Factors such as substance abuse, untreated symptoms, and a lack of access to proper treatment and support can contribute to a small minority of individuals with mental health conditions being involved in violent behavior. Stigmatizing people with mental health problems as inherently violent can perpetuate harmful stereotypes and hinder efforts to support those who need help. Instead, it's important to focus on promoting understanding, compassion, and access to appropriate mental health care for all individuals. Next question. People can recover from mental illness. Myth or fact? And that is actually a fact. Absolutely, people can and do recover from mental illness. Recovery looks different for everyone and may involve various strategies such as therapy, medications, changes in lifestyle, and social supports. Recovery doesn't necessarily mean the absence of symptoms, but rather learning to manage them effectively and improving overall well-being. Many individuals with mental health conditions lead fulfilling lives, maintain meaningful relationships, pursue their life's goals, and contribute to their communities. It's essential to promote a message of hope and recovery, reduce stigma, and ensure that individuals have access to the resources and support they need to achieve their recovery goals. With the right support and treatment, recovery from mental illness is not only possible, but it is also achievable. So, myth or fact? The stigma and discrimination around a mental illness can be more difficult than the illness itself. And that is actually a fact. The stigma and discrimination surrounding mental illness can indeed exacerbate the challenges individuals face, often making it more difficult than dealing with the illness itself. Stigma can manifest in various ways, including social exclusion, stereotypes, prejudice, and discrimination in employment, housing, and healthcare settings. The fear of being judged or treated differently can prevent individuals from seeking help and support, leading to delayed treatment and the exacerbation of symptoms. This can perpetuate a cycle of suffering and silence and isolation. Addressing stigma requires collective efforts at multiple levels, including raising awareness, promoting education about mental health, challenging stereotypes, and fostering empathy and understanding, creating supportive environments where individuals feel safe to talk openly about their experiences and seek help without fear or judgment is critical in reducing stigma and improving outcomes for those affected by mental illness. So, myth or fact, there's not much you can do to help a friend experiencing mental health problems. And that is a myth. While it may feel daunting, there are many ways you can support a friend experiencing mental health problems. Listening without judgment, sometimes simply being there to listen without offering advice or judgment can be incredibly helpful. Educating ourselves, learn about your friend's specific mental health condition so you can better understand what they're going through. Offer empathy and validation. Let your friend know that you're there for them and that their feelings are valid. And also, encourage professional help. Offer to help your friend or family or loved one find a therapist, counselor, or psychiatrist if they're open to it. You can even offer to accompany them to appointments for support. Staying connected is important. Keep in touch with your friend, loved one, family member regularly, even if it's just a quick check-in to let them know that you're thinking of them. Offer practical support, help with daily tasks or offer to run errands if your loved one is struggling to manage them. Encourage self-care. Remind your loved one to prioritize self-care activities such as getting enough sleep, eating well, exercising, and engaging in activities they enjoy. Respect, you would want to respect their boundaries, understand that your loved one may not always want to talk about their mental health or may need time and space, before they're ready to share what they're going through with you. Be patient and persistent. Recovery from mental health problems can take time. So be patient and continue to offer your support to your loved one. And, taking care of yourself is also very important. Supporting a loved one, a friend with mental health problems can be emotionally draining. So make sure you're also taking care of your own mental health needs. Your support can make a significant difference in your loved one's journey towards recovery and well-being. So, next question, myth or fact? People can't work if they have a mental health problem. And you know what? That is actually a myth. People with mental health problems can absolutely work and thrive in their careers. While mental health challenges may present obstacles, many individuals with mental health conditions are able to manage their symptoms effectively and maintain successful careers. Employers are increasingly recognizing the importance of supporting employees' mental health and creating workplaces that foster well being. Accommodations such as flexible work arrangements, access to mental health resources, and supportive management can help individuals with mental health conditions actually thrive in the workplace. It's important for individuals with mental health conditions to prioritize self care, seek appropriate treatment and support, and communicate their needs to their employers. You know, with the right support and accommodations, many people are able to work productively and contribute meaningfully to their workplaces despite their mental health challenges. And next I'm showing a picture of some famous people here. And, can anyone guess what they have in common? Well, each one of them, has a mental health issue or has spoken about it. We have up in the upper left-hand corner, that's Michael Phelps. He's one of the most decorated Olympians of all time, is a famous person with a mental illness. And in his case, it's ADHD, attention deficit hyperactivity disorder. And he was diagnosed in grade school, but has learned techniques to deal with this challenge. In the lower left-hand corner, we have Catherine Zeta-Jones. She has been very open in the press about not only having bipolar type 2 disorder, but also about having to get help for that disorder, which include stays at a psychiatric hospital. Then in the upper right-hand corner, we have Simone Biles. She stood proud about her diagnosis of ADHD. After a hacker a couple of years ago had released her medical records for I guess for the world to see, she tweeted about it, and she said that having ADHD and taking medication for it is nothing to be ashamed of, nothing that I'm afraid to let people know. So instead of being shamed for use of illicit drugs like the hacker had intended, Biles became a bigger inspiration. And she said, I have ADHD and I have taken medication for it since I was a kid. Please know, I believe in a clean sport, have always followed the rules, and will continue to do so, as fair play is critical to sport and very important to me. In the middle, at the top, we have Ransman, who's also an Olympic medalist, who has obsessive compulsive disorder, or OCD. And, she has stated that mental health is an up and down journey. It helps taking it day by day and being able to tell myself, okay, this is just going to be a tough day. One tough day or one tough morning doesn't mean I'm going to feel like this forever. Then in the lower right-hand corner, we have Lady Gaga. Despite her success in both music and acting, she spoke out openly, I believe it was maybe about 5 or 6 years ago, about her struggles with post-traumatic stress disorder. She admitted in an interview that she was the victim of a rape that happened when she was 19. And she said that my own trauma in my life has helped me to understand the trauma of others. And, she also says she has also dealt with both depression and anxiety her whole life, and she isn't ashamed to admit it. She takes medication for depression. And in an interview, she said that she thinks it's important for people to talk about their mental health. If we share our stories and stick together, we're stronger. And then lastly, in the at the middle column at the bottom, we have The Rock. And he opened up about depression and said that the struggle and pain is real. Johnson, who saved his mother from a suicide attempt when he was 15, said that depression never discriminates. It took him a long time to realize it, but the key is not to be afraid to open up. And he said, especially for us guys who, have a tendency to keep it in, and just to know that you're not alone in this. So I just wanted to show that, mental health issues is widespread, and, we may be experiencing it within, our own families, within our own communities, and friendship groups, and that there are celebrities and famous individuals out there who also are struggling with mental health issues and are very successful and lead normal, healthy lives. So, what is mental health? So, on the screen, there's a definition by the World Health Organization of mental health. And mental health refers to our emotional, psychological, and social well being. It encompasses how we think, feel, and behave, as well as how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. It affects how we cope with life's challenges, how we form relationships, and how we make decisions. And good mental health is not just the absence of mental illness, it also involves resilience, self esteem, and the ability to enjoy life. And within the definition of mental health, I've highlighted some things. A state of well-being, realizes his or her own abilities, cope with the normal stresses of life, which we all have, different stresses in life at any different time. Work productively and fruitfully, and able to make a contribution. So, breaking it down and taking that first sentence, state of well-being. And that refers to the overall condition of an individual's physical, mental, and emotional health. It encompasses various aspects such as feeling content, fulfilled, and satisfied with life. Achieving a state of well being involves maintaining a balance in different areas of life, including relationships, work, leisure activities, and self care practices. It's not just the absence of illness, but also the presence of positive emotions, resilience to stress, and a sense of purpose and meaning in life. Realizing his or her own abilities. And realizing one's abilities involves recognizing and understand one's own strengths, talents, and potential. It's about acknowledging what you are capable of and leveraging those abilities to achieve personal and professional goals. This self awareness can empower individuals to pursue their passions, overcome challenges, and make meaningful contributions to their own lives and the lives of others. Recognizing one's abilities is an essential aspect of personal development and self actualization. Coping with normal stresses of life, involves developing strategies and skills to effectively manage everyday challenges, setbacks, and pressures, such as self-care, prioritizing your physical and mental well-being by getting enough sleep, eating healthy, exercising regularly, and engaging in activities that bring you joy and relaxation. Seek social support, sharing your feelings and concerns with trusted friends, family members, or a support group. Talking to others can provide a perspective, a validation, and comfort during difficult times. Develop problem solving skills, breaking down problems into manageable steps, and brainstorming potential solutions, focusing in on what you can control and take proactive steps to address challenges. Um, Practice mindfulness and relaxation techniques, incorporating mindfulness, meditation, deep breathing exercises, or progressive muscle relaxation into your daily routine to reduce stress and promote calmness. Maintaining a positive outlook, challenge negative thoughts and practice gratitude. Focus on your strengths, past successes, and the lessons learned from adversity. Setting boundaries, learn to say no to unrealistic demands and prioritize tasks based on importance and urgency. Establishing healthy boundaries can prevent burnout and feelings of becoming overwhelmed. And also seeking out professional help if needed. If you're struggling to cope or experiencing persistent distress, don't hesitate to seek support from a therapist, a counselor, or mental health professional. They can provide guidance, strategies, and interventions tailored to your specific need. So, that's just some of the ways that, we ourselves can kind of cope with just sometimes normal stresses of life that may get to become a little bit too much for us at times. So next, working productively and fruitfully, as in the definition, that involves maximizing your efficiency and effectiveness to accomplish tasks and goals in a meaningful way and making a contribution. That involves adding value and positively impacting the world around you, whether it's in your community, workplace, or broader society. And, that includes volunteering, helping out in your community, those activities such as those. So some key issues in mental health. Mental health and physical health go hand in hand. You can't have one without the other. Wellness implies that it is not just about the absence of symptoms. Wellness is the act of practicing healthy habits every day to have better physical and mental health. And wellness involves physical, emotional, intellectual, social, spiritual, and environmental and occupational well-being. So, the concept of mental health and mental illness not being opposites, but rather existing on a continuum reflects the understanding that mental well-being exists on a spectrum with varying degrees of health and illness. And, here are some examples just to kind of illustrate that concept a little bit. So, mental health, remember, we said that mental health encompasses a range of factors, including emotional well-being, psychological resilience, and the ability to cope with stresses. At one end of the continuum, individuals may experience optimal mental health. And this is usually characterized by feelings of happiness, fulfillment, and a sense of purpose in life. They may exhibit positive coping mechanisms, strong social connections, and adaptive behaviors that contribute to their overall well-being. Now, mild distress or subclinical symptoms, moving along that continuum, individuals may experience mild distress or subclinical symptoms that fall short of meeting the criteria for a diagnosable mental illness. For example, the individual, or they may occasionally feel anxious or sad or overwhelmed by life's challenges, but these feelings do not significantly impair their daily functioning or quality of life. Then moving along, we have moderate mental health challenges. So further along that continuum, individuals may experience moderate mental health challenges that affect their functioning to a greater extent. They may exhibit symptoms of common mental health conditions such as generalized anxiety disorder, depression, or substance abuse. And while these challenges may interfere with daily activities, relationships, and overall well being, individuals may still have periods of relative stability and functioning. And then there's, at the other end of the continuum, individuals may experience severe mental illness that significantly impairs their ability to function in various areas of life. They may, this may include conditions such as schizophrenia, bipolar disorder, or severe depression with psychotic features. These conditions can have a profound impact on an individual's cognition, emotions, behavior, and overall quality of life, often requiring intensive treatment and support. Importantly, individuals can move along the continuum in both directions, experiencing fluctuations in their mental health over time. Recovery from mental illness is possible, and many people are able to regain a sense of stability, purpose, and well-being with appropriate treatment, support, and self-care practices. Similarly, individuals with optimal mental health may face challenges or setbacks that temporarily impact their well-being, but can bounce back with resilience and support. Mental health is fluctuated by a complex interplay of various factors, and many of which are beyond our direct control. Some examples of this, or things that can impact our mental health, are biological factors. Having genetic predispositions, neurochemical imbalances, and physical health conditions can all influence mental health. Certain genetic factors may increase the risk of developing mental illness, such as depression or schizophrenia, while hormonal changes, during puberty or pregnancy or menopause can affect mood and affect overall well-being. Environmental factors, social, economic, and environmental factors can significantly impact mental health. Exposure to trauma, violence, abuse, or discrimination can increase the risk of developing mental health disorders. Additionally, social economic status, access to resources, and living conditions can affect stress levels and mental well-being. Life experiences, life events such as a loss, trauma, relationship difficulties, or a major life transition, for example, moving or starting a new job, becoming a parent, can have a profound impact on mental health. Positive experiences such as supportive relationships, meaningful work, and personal achievements can also contribute to the overall well-being. Social support, strong social connections and supportive relationships play a critical role in mental health. Social support networks provide emotional validation, practical assistance, and a sense of belonging, which can buffer against stress and adversity. Social isolation, loneliness, or lack of social supports can increase the risk of mental health problems. Cultural factors, cultural norms, beliefs, values, and practices shape how individuals perceive and experience mental health. Stigma surrounding mental illness, cultural expectations regarding emotional depression, and the access to culturally sensitive mental health services can all influence mental health outcomes within different cultural contexts. Um, Something else that can play into our mental health is access to healthcare. Access to mental health services, including affordable and culturally competent care, plays a significant role in promoting mental health and well-being. And barriers such as financial constraints, lack of insurance coverage, transportation issues, and stigma, again, may prevent individuals from seeking or receiving the appropriate treatment. And, lastly, psychological factors, psychological and social factors such as coping skills, resilience, self-esteem, and a sense of purpose can impact mental health outcomes. Positive coping strategies, effective problem-solving skills, and a strong sense of self-efficacy can promote resilience and buffer against stress, while maladaptive coping mechanisms or negative thought patterns may contribute to mental health problems. So, barriers to seeking help. The stigma surrounding mental health can prevent individuals from seeking help when it's needed. Fear of being judged or labeled negatively may lead people to avoid reaching out for support, which can worsen their condition over time. Um, Another key issue with mental health is self-stigma. When individuals internalize negative stereotypes and beliefs about mental illness, they may experience self-stigma, and this can lead to feelings of shame, low self-esteem, and reluctance to disclose their struggles or seek treatment. Social isolation. Stigma can contribute to social isolation and exclusion. Individuals may withdraw from social activities or relationships due to fear of judgment or rejection, which can exacerbate feelings of loneliness and depression. Stigma can also impact or have an impact on treatment. It can influence the quality and effectiveness of mental health treatment. Individuals may be hesitant to disclose their symptoms honestly to healthcare providers, or may avoid seeking treatment altogether, leading to delays in receiving appropriate care. Stigma can lead to employment and housing discrimination. Discrimination based on mental health can affect various aspects of a person's life, including employment and housing opportunities. And discriminatory practices can lead to unemployment, financial instability, and homelessness, further worsening mental health outcomes. Internalization of discrimination. So experiencing discrimination can lead to the feelings of anger, frustration, and helplessness. Internalizing these experiences can contribute to the development or exacerbation of mental health conditions such as anxiety and depression. So addressing stigma and discrimination is critical for promoting mental health and well-being. Creating supportive environments, increasing public awareness and education, and challenging stereotypes are essential steps in reducing the negative impact of stigma on individuals with mental health problems. Additionally, ensuring access to quality mental health services and promoting inclusivity in all aspects of society can help mitigate the harmful effects. So did I move on? Okay, so I think it's at that one. Okay. So, and last but not, least, supporting a loved one with mental health issues can emotionally and physically be draining, often leaving families and partners feeling overwhelmed, stressed, and isolated. It's essential for them to seek help and support to navigate these challenges effectively. By reaching out for assistance, whether through therapy, support groups, or educational resources, families and partners can gain valuable insight, coping strategies, and a sense of community. Seeking help not only benefits the individual with mental health issues, but also fosters healthier relationships, improves communication, and reduces the risks of caregiver burnout. Additionally, understanding the complexities of mental health and learning how to provide effective support can strengthen bonds within the family and create a more nurturing environment for everyone involved. So on this next slide, if everyone is still with me, I'm just going to kind of just talk a little bit about some of the most common mental health conditions that are out there. We have ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental condition characterized by persistent patterns of inattention, impulsivity, and hyperactivity that can significantly impact an individual's daily functioning and quality of life. People with ADHD may have difficulty sustaining attention on tasks, organizing activities, or following through on instructions. They may also struggle with impulse control, often acting without considering consequences. And additionally, hyperactivity symptoms can manifest as fidgetiness, restlessness, or excessive talking. ADHD varies in severity and can affect people of all ages, though it is often persists in childhood and may persist into adulthood. While there is no cure for ADHD, various treatments such as medication, therapy, and behavioral interventions can help manage symptoms and improve functioning. Understanding and support from family, educators, and healthcare professionals are critical in effectively navigating the challenges associated with ADHD. You know, another common mental health condition that we see is anxiety. And anxiety is a normal response to stress or perceived threats, characterized by feelings of worry, fear, and nervousness. While occasional anxiety is a normal part of life, excessive or persistent anxiety that interferes with daily activities may indicate an anxiety disorder, and symptoms can vary widely, including restlessness, irritability, difficulty concentrating, and physical sensations such as a rapid heartbeat or sweating. Anxiety disorders can significantly impact a person's quality of life, but effective treatments such as therapy, medication, and lifestyle changes are available to help manage symptoms and improve overall well-being. Depression. You know, depression is a mood disorder characterized by persistent feelings of sadness, hopelessness, and disinterest in activities once enjoyed. It can affect how you think, feel, and handle daily activities, often leading to changes in sleep patterns, appetite, and energy levels. Depression is more than just feeling down. It's a serious condition that can impact all aspects of life and may require treatment, such as therapy, medication, or a combination of both to alleviate symptoms and improve the quality of life of the individual. Then we have trauma. Trauma refers to a distressing or disturbing experience that overwhelms an individual's ability to cope, leaving lasting emotional or psychological effects. It can result from various events, such as an accident, a natural disaster, violence, or abuse. And it is often associated with feelings of fear, helplessness, or horror. Trauma can impact a person's sense of safety, trust, and self-esteem, leading to symptoms such as flashbacks, nightmares, avoidance, or heightened arousal. Treatment approaches like therapy, support groups, and holistic healing practices aim to help individuals process and overcome trauma, fostering resilience and restoring well-being. Then there's alcohol and substance use. And this involves the consumption of substances such as alcohol and drugs or medications in a way that can lead to negative consequences. While moderate use of certain substances may be socially acceptable or even beneficial, excessive or problematic use can lead to addiction, health problems, impaired judgment, and strained relationships. Substance use disorders are complex conditions influenced by genetics, environmental, and psychological factors, and they often require comprehensive treatment approaches, including therapy, support groups, and medical interventions to address physical and psychological dependencies and promote recovery and well-being. Now, under examples of some severe mental health issues, there's bipolar disorder, and it's a mental health condition characterized by extreme mood swings that includes episodes of manic highs and depressive lows. During manic episodes, individuals may experience heightened energy, euphoria, impulsivity, and decreased need for sleep, while depressive episodes involve feelings of sadness, hopelessness, low energy, and difficulty concentrating. And these mood swings can vary in severity and frequency, significantly impacting daily functioning and relationships. Treatment typically involves mood stabilizing medications, therapy, and lifestyle adjustments to manage symptoms and promote stability. And early diagnosis and comprehensive management can help individuals with bipolar disorder, lead fulfilling lives. And schizophrenia, this is a chronic and severe mental disorder characterized by distorted thinking, hallucinations, delusions, and impaired social functioning. Individuals with schizophrenia may experience disruptions in perception, cognition, and emotions, leading to difficulties in distinguishing between what is real and what is not. Symptoms often emerge in early adulthood and can vary in intensity, causing significant distress and impairment in daily life. Treatment typically involves antipsychotic medications, therapy, and support services to help manage symptoms and improve quality of life. And although outcomes vary widely among individuals, early intervention and ongoing support are again critical in promoting recovery and managing the challenges associated with schizophrenia.
Ms.
So
Coley,
yes.
we had a question.
You do? Okay.
Do you have any information on who diagnoses ADHD?
Usually a psychologist can diagnose ADHD, a psychiatrist can diagnose ADHD. Some clinical social workers and LPCs, they can also diagnose ADHD. Does that answer the question? And also, a primary care physician. So,
Yeah, you.
okay, got it. So treatment, some treatments for, mental health and mental well-being. There's therapy. Psychotherapy, also known as talk therapy, involves talking with a trained therapist to understand and work through your thoughts, feelings, and behaviors. Different types of therapy include cognitive behavioral therapy, interpersonal therapy, and psychodynamic. There's medications such as antidepressants, mood stabilizers, antipsychotics, and anti-anxiety medications are often used to manage symptoms of various mental health conditions. And These are typically prescribed and monitored by a psychiatrist or other mental health professional. Lifestyle changes, making positive lifestyle changes such as regular exercise, healthy diet, adequate sleep, and stress management techniques can significantly improve mental well-being. And support groups, joining support groups or peer support networks can provide a sense of community and understanding, especially for those dealing with specific mental health conditions. It's important for individuals with mental health concerns to work with qualified professionals to determine the most appropriate treatment plan for their specific needs. Treatment plans are often tailored to each individual's unique circumstances, preference, and goals. So, what should I be on the lookout for? When supporting someone, or a loved one, family member, friend with mental health issues, it's critical to be observant and understanding. And here are some things to look out for. Changes in behavior. Watch for significant changes in behavior, such as increased isolation, withdrawal from activities they once enjoyed, or sudden mood swings. Be aware of physical symptoms that may accompany mental health issues, such as changes in appetite, sleep disturbances, unexplained aches or pains, or changes in personal hygiene. Pay attention to any direct or indirect expressions of distress, such as talking about feeling hopeless, overwhelmed, or worthless, or expressing thoughts of self-harm or suicide. Notice any changes in substance use patterns, including increased use of alcohol or drugs as a way to cope with emotional distress. Be mindful of social withdrawal or avoidance of social situations, which may indicate feelings of anxiety, depression, or other mental health concerns. Look for signs of difficulty coping with everyday tasks or responsibilities, such as problems at work or school, difficulty concentrating, or increased irritability. Notice changes in appearance, such as neglecting personal hygiene or a significant change in weight, which may indicate underlying mental health issues. Be alert to any self-destructive behaviors, such as self-harm or engaging in risky activities, which may be a sign of emotional distress. Monitor or look out for a decline in functioning in various areas of life, such as work, relationships, or academic performance. And take note if your loved one or the individual loses interest in activities they once enjoyed, or shows a lack of motivation to engage in usual hobbies or pursuits that they may have. It's important to approach these observations with compassion and without judgment. If you notice any concerning signs, encourage the person to seek professional help and offer your support in finding appropriate resources. And remember to prioritize your own well-being as well. And don't hesitate to reach out for guidance if you're unsure how to best support someone with a mental health issue. So some coping mechanisms, which are broken up into, positive coping mechanisms and then, negative coping mechanisms. Positive coping mechanisms can help individuals manage their mental health challenges and build resilience. Mindful meditation, practicing this technique can help individuals stay grounded, reduce stress, and improve overall well-being. Exercise, regular physical activities such as walking, running, yoga, or dancing can boost mood, reduce symptoms of depression and anxiety, and improve overall health and well-being. Exercise releases endorphins, which are a natural mood lifter. Eating a balanced diet, getting enough sleep, and avoiding exercise, alcohol, and drug use can support mental health, Proper nutrition and adequate sleep can help regulate mood and energy levels. Connecting with supportive friends, family members, or support groups can provide comfort, encouragement, and a sense of belonging. Social support can help individuals feel less isolated and better able to cope with stress. Engaging in creative activities such as painting, writing, playing music, or crafting can be therapeutic and help individuals express their emotions in a positive way. Again, practicing relaxation techniques such as deep breathing exercises, progressive muscle relaxation, or visualization can help reduce feelings of anxiety and promote a sense of calm. Setting boundaries, seeking professional help, um, being active or getting engaged in activities that bring joy and fulfillment, such as gardening, playing sports, or volunteering, can distract from negative thoughts and improve mood. And having self compassion. Practicing self compassion involves treating oneself with kindness and understanding, especially during difficult times, encouraging individuals to practice self care and to be gentle with themselves can promote resilience and emotional well being. So, how can I get help? And we had talked a little bit about recognizing the signs. Be aware of changes in thoughts, feelings, or behaviors that may indicate a mental health concern, such as persistent sadness, anxiety, irritability, or difficulty functioning in daily life. Talking to someone or reaching out to a trusted friend, family member, or healthcare professional about what you're experiencing. Consulting a healthcare provider, exploring treatment options. Depending on your needs, treatment may include therapy or medication. Looking into different resources, taking action. Once you've have those resources, following through with recommended treatment plans, and actively participate in therapy or support groups or whatever it is that you're choosing to utilize to help you. Keep an open line of communication with your healthcare provider and advocate for your needs, and practicing self-care. And on this next side, there's just some places where you can go for help. If you're feeling suicidal or you need someone to talk to, there's a new National Suicide Prevention Lifeline that you can always call. There's also the 988 suicide hotline. Then there's MHID, Nueces Center for Mental Health and Intellectual Disabilities. There's the Corpus Christi Medical Center Behavioral Health Division. And then there's also the Natural Alliance on Mental Health, NAMI, of Greater Corpus Christi. So that is the end of my presentation for this morning on mental health and mental wellness. And I want to just thank you guys again for having me out this morning to talk to you on this topic. And we have a few minutes left. So if you have any questions, any comments, any thoughts.
Hi, my name is
Hello.
Kesla. I didn't know ADHD was a mental health issue.
It's considered a mental health issue. It's one of those mental health issues that, it's not on that when I was talking about on the continuum, it's the extreme, but it is considered a mental health issue that can, sometimes be addressed with medication. And therapy usually centers around building up maybe learning time management skills, or how to
Oh,
prioritize, or just different ways to be able to get you to focus a little bit.
that's I have a son, and he was diagnosed long time ago
Mhm.
um, by his pediatrician, but I thought like he needed to be diagnosed by like a psychiatrist or psychologist, and I don't know the difference between a psychiatrist and a psychologist.
Okay. Well, a psychiatrist is a MD, so it's a medical, it's a doctor that actually is able to prescribe medications for, different mental health conditions and concerns. So their specialty or their practice is mental health issues and mental health disorders. So, they prescribe medications for, anxiety, depression, bipolar disorder.
Okay.
Um, a,
Okay.
psych- a psychologist is if they have a PhD, they are a doctor, but they're not a medical doctor. But their practice and their specialties is, in testing and being able to also diagnose different mental health disorders and conditions. I don't know if
Okay.
that makes sense or did that explain?
Well, if I wanted to take my son
Hmm.
to someone other than his pediatrician, because I know he has ADHD. That's
Yes.
like so everybody that knows him
Yeah.
can tell he has ADHD or he can
Uh-huh.
just stay still. But
Hmm.
I know he has, it seems to me that, and I'm not very I mean, as he's growing, because he's a teenager now, I
Yes.
can see his like moods, they change fast, and sometimes I'm like he's okay, and then something happens and he goes like depressed really quick,
Got it.
and then it's hard for me to like to get him to, okay, let's this is just, and let's
Hmm.
work it out, and then he's okay. And but I've noticed that when he gets discouraged because something happened, and he gets discouraged, like
Hmm.
before it was just going to bed and going to sleep, and then like lately it's like, okay, I'm gonna go to the closet, turn off the lights, and just don't let anybody eat. And that kind of scares me a little bit.
Yeah. Well, you know what I would recommend is that, maybe seeking out a psychiatrist, just to maybe diagnose and get him on possibly the right medication regimen that could possibly help him. But also seeing or working with a counselor that can kind of help him manage the symptoms, and again, to teach time management skills,
Yes.
or maybe just come up with different ways to kind of help him to be able to focus in. So get him to recognize when he's starting to lose focus, and what can help him come back and focus in on the task at hand. So
Mhm.
you can go to a psychiatrist, to for medication management and to get a diagnosis, but you can also see a psychologist that can also do testing, and also psychologists, LPCs, clinical social workers. They can, work with the therapy piece in terms of teaching him the skills, that he'll need in order to kind of help him to focus a little bit better.
Okay, thank you.
Kayla,
Okay, and we always, there's T-chat services, so you can always speak to your counselor if that's something that you're concerned about, and a referral to T-chat may help as well. I'm sorry, Dr. Fowler.
I was just gonna interject. I'm sorry. I was just gonna say that I can send resources to you through your email. Miss Kayla, I can send you
Yes,
email. I'll send you a list of resources and some information too. Okay, once we're done with this meeting.
yes, that'll be helpful. Thank you.
Okay.
Okay, so I hope that was helpful, Miss Kayla.
Yes, yes, yes. I sometimes I don't know. I know he has ADHD, and I know, um, so my husband is a little bit on the like side of no medicine.
Mhm.
And that's something like I feel like he needs it and he feels he needs it. He's like, I
Mhm.
just want to see if I can just focus with it. And he's like, no, no, you're gonna be able to cope with it. And I'm like, but because he's passing all his classes,
That's fantastic.
but I know his struggles. I know his struggles,
Mhm.
and before he failed or something, and he was okay. He will cry and let it out. But I feel like he's going deeper when he's depressed, or I don't know.
Mhm.
It's scary me now that I'm like, okay, this is not right.
Mhm. Well,
So
it's good that you're noticing, the signs and symptoms, that's going on with your son, and the resources that Dr. Fowler can provide, I'm quite sure will kind of get you on that right path to getting the help that he needs and the
yes,
support.
yes, yes. I think he needs to talk to somebody because
Mhm.
he doesn't want to talk to me because I'm his mom. But
I will
yeah,
send you resources and get you moving on the right track. And if you need help navigating the system or anything like that in Corpus Christi, I'll help you. So
Mhm.
don't worry about that. So I'll send them through email and explain everything to you in the email. Okay?
thank you. Thank you so much.
You're welcome.
All right. Well, again, thank you guys, for inviting me to do this presentation, for you. And I know that the end of the school year is kind of coming, so enjoy your summers.
Thank you so much. That was really good. And if anybody else needs resources, they can always contact me and I will help them navigate the mental health system here
Yes.
in Corpus Christi.
All
So
right.
thank you so much.
Thank you so much, Dr. Fowler, and you have a great rest of your day.
You too.
Thank you. Bye-bye.